You have been scheduled for radioactive iodine therapy because your physician believes this treatment will be beneficial in the management of your thyroid disease. Radioactive iodine will be used to eliminate persistent thyroid cancer and help to prevent the growth of recurrent disease in the future. This procedure will involve ingesting radioactive iodine, which will be absorbed by both normal and cancerous thyroid cells located in your neck as well as elsewhere in your body. The radioiodine is transported into the thyroid cells, and the released radiation particles will deliver radiation to the tumor, which will destroy the remaining thyroid tissue. The appropriate dose of radioactive iodine has been determined by your team of physicians in conjunction with your nuclear medicine specialist. They will be happy to explain how they arrived at that dose. To maximize absorption of the radioactive iodine from your gastrointestinal tract, you should not eat or drink for 2 hours after the treatment. After treatment, there is a mandatory period of isolation until the radioactive iodine is excreted from your system and you are no longer considered a risk to others. This will usually last about a week. The exact isolation period you should follow is dependent on the dosage you receive. There are some general rules for the isolation period to protect others and the environment from being contaminated by the radioactive iodine. It is important to understand that the radiation leaves your body through urine, sweat, oral and nasal secretions, as well as through bowel movements. In addition, there is radiation emitted from your body, and the risk to others is dependent upon how far away they are from you. There is another video explaining the precautions that you should follow. Additionally, your doctor will give you a pamphlet or a sheet of paper with very specific isolation instructions. He or she will also give you a letter card which you should carry around with you for 3 months while traveling after treatment, because you may trigger radiation detectors in public places. This therapy can cause some negative side effects. A common side effect of radioiodine is nausea or a feeling of queasiness that can last for several days after treatment. While it's quite rare to actually vomit, the nausea can be quite unpleasant, and patients often elect to take prescription anti-nausea medications. If you feel like you're about to vomit, be careful to do so in the toilet bowl, and afterwards clean up and call a physician for further instructions. If you vomit elsewhere, try to control it as much as possible and call your physician for instructions on proper cleanup. Another possible side effect is injury to the salivary glands. The salivary glands are located behind and under the jaw. They produce saliva, which helps to moisten and chew food, as well as aid in digestion. Like thyroid tissue, the salivary glands can concentrate radioiodine, which can cause several days of swelling and tenderness. You may also experience a temporary loss of taste, or the development of a strange taste in your mouth that can last up to several weeks. While the side effects mentioned will subside within weeks, you may experience discomfort such as dry mouth or occasional swelling of the salivary glands for up to 1 year after treatment. It can be treated with massage, warm compresses, and sometimes a course of antibiotics. For ongoing problems, you would need to see a specialist. Salivary gland problems are quite common after high-dosage radioiodine treatment or after repeated treatments. This can be mitigated by limiting radiation exposure to the glands by using the smallest dose of radioiodine possible, as well as by consuming lots of fluids during the week after treatment. Exercise your salivary glands by taking lemon lozenges or lemon juice every hour or so to decrease the radiation exposure to the salivary glands. A common concern for many young women and men is the possible effect of radioiodine on the ability to bear healthy children in the future. Fortunately, radioiodine treatment does not interfere with fertility in the long run or cause birth defects. However, women should wait 6 to 12 months before trying to conceive, and men should wait 3 to 6 months before fathering children. Radioiodine therapy can decrease the sperm count temporarily, but it will return to normal several months after low-dose treatments and 12 months after high-dose treatments. Sperm banking for men is unnecessary after 1 or 2 radioiodine treatments, but should be considered after multiple high-dose treatments. Another common concern with radioactive iodine therapy is the development of new types of cancers. If you need a high-dose treatment or repeated treatments, there is an increased risk of developing new tumors or malignancies 5 to 10 years after treatment. This includes lung cancer, breast cancer, cancer of the stomach, colon, or lymphoma or leukemia. However, your physician has determined that the potential benefit of controlling thyroid cancer outweighs these possible negative side effects. Following this video, you will be provided with a copy of instructions, and you will be asked to sign a consent form. Your physician will be happy to answer any questions you might have.